listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static.
In today's episode, we've got details on the proposed marketplace changes we think agents should know about. Recent ACA coverage changes reversed with the 2025 Marketplace Proposed Rule, written by Emily Ryan. On March 10th, the Centers for Medicare and Medicaid Services, CMS, released the Marketplace Integrity and Affordability Proposed Rule. It aims to improve consumer protections and increase the integrity of the marketplace. This new proposed rule is the first of the Trump administration's second term and comes shortly after the Marketplace Final Rule that was published on January 13th, 2025. We're covering the major reversals and highlights from the 2025 proposed rule. The following protections were finalized in the 2026 Final Rule, but will be reversed if the recent Marketplace Proposed Rule is finalized as is. The first proposed change we'll look at is payment thresholds. CMS is proposing to eliminate 2 of the 3 recently finalized payment thresholds: the permit fixed option, aka the fixed dollar threshold, and one of the premium percent options, the gross premium threshold. This only leaves the percentage-based net premium threshold. The percentage-based net premium threshold allows clients who pay at least 95% or another amount designated by the carrier of their premium after their tax credits are applied to avoid being placed into a grace period. When left unresolved, grace periods can cause coverage gaps for low-income clients. The goal of this change is to enhance marketplace integrity by holding clients responsible for paying their monthly premiums. With the previous rise in fraudulent enrollments, this may mitigate the risk for clients who were enrolled in marketplace coverage improperly or without their knowledge. Reducing the tax reconciliation requirement. Anyone who receives premium tax credits must reconcile them when filing their taxes. Previously, clients had 2 years to complete this process before re-enrolling or enrolling in new coverage. CMS is now proposing only 1 year for reconciliation. By reinstating the 2015 policy, the marketplace aims to reduce improper enrollments and protect consumers from being liable for tax penalties. Moving on to notable marketplace changes. Reducing the open enrollment period. The proposed rule aims to change the Federal Annual Open Enrollment Period, OEP, to run from November 1st through December 15th. Notably, the rule mentions that doing so will, quote, reduce consumer confusion, streamline the enrollment process, align more closely with open enrollment dates for many employer-based health plans, encourage continuous coverage, and reduce risk of adverse election from consumers who otherwise may wait to enroll until they need healthcare services. End quote. It's important to note that this proposal shortens the OEP by a month. Agents who serve both Medicare and ACA clients will only have 1 week of the OEP that doesn't overlap with Medicare's annual enrollment period, which runs October 15th to December 7th. The new OEP dates are only for the federal marketplaces. Other state-based marketplaces could decide to adopt similar dates to mirror the federal exchange. Visit the episode notes for our post on the Ritter blog all about selling in state-based marketplaces. Eliminating the 150% FPL SEP to, quote, maintain program integrity, end quote, and reduce the strain on American taxpayers, CMS is seeking to eliminate the Special Enrollment Period, SEP, triggered when household income is less than 150% of the federal poverty level, FPL. This SEP is significant for states that may not have extended Medicaid coverage. Low-income individuals who reside in a state that has not expanded Medicaid coverage may have to wait until the OAP to enroll in ACA coverage. If they've experienced a dramatic change in household income, this could mean months without coverage. This change only affects the federal marketplace. We will continue to monitor state-based marketplaces and their adoption of this change. So be sure you're following along with the podcast to stay up to date. Stringent eligibility verification. The Trump administration proposes to remove the requirement that marketplaces accept self-attestation of projected income when no tax return data is available. Income will have to be verified through documentation or other trusted data sources. Limited extensions to verify income will also be available if this proposed rule is finalized. They also propose to require all marketplaces to verify eligibility for at least 75% of new enrollments through SEPs. CMS states this policy would, quote, ensure more consistent application of eligibility criteria and reduce instances of improper enrollments, which can lead to a more balanced risk pool and potentially lower premiums, benefiting consumers, end quote. Automatic enrollments to have a $5 premium responsibility. According to another proposed change, when an individual automatically re-enrolls in a plan, they will be responsible for a $5 monthly premium. In many cases, enrollees are placed in a plan that has a fully subsidized premium, whether they reaffirm their annual income or not. This new guidance will allow clients to be re-enrolled, but will require them to assert their household income. The $5 premium responsibility would be eliminated after this process. Removing re-enrollment hierarchy standard. Moving forward, CMS aims to remove the re-enrollment hierarchy requirement. Currently, consumers enrolled in a bronze plan can be re-enrolled year over year to a silver plan as long as they have the same network and the new plan has a lower or equal premium and is also a qualified health plan. The Trump administration has proposed to remove this requirement to, quote, respect consumer choice and reduce confusion, end quote. Consumers who are re-enrolled in another metal tier may not realize that they will be liable for subsidies when it is time to file their annual taxes. Amending the lawfully present definition. The 2025 proposed marketplace rule seeks to amend the definition of lawfully present to exclude deferred action for childhood arrivals, DACA recipients. This change would block the demographic commonly called Dreamers for enrolling in a marketplace plan at the federal level and would make them ineligible for premium tax credits. Upcoming things to watch out for. Some of these changes may have significant impact on health insurance agents. There has not been any specific information about state exchanges adopting legislation that would mirror the federal exchange in regard to terminating agents, automatic re-enrollments, or altering OAP dates. If you're an agent selling under 65 plans in a state marketplace, pay attention to changes that are a result of this proposed rule. For agents selling ACA insurance and Medicare plans, the proposed change in enrollment period also means only 1 week between the Medicare Annual Enrollment Period, AEP, and the Marketplace OAP. This could mean an extremely demanding enrollment season for agents if finalized. Additionally, agents who are not compliant could face termination. CMS proposes to add a definition of, quote, preponderance of the evidence, unquote, to improve transparency and hold agents accountable. These changes could protect clients from bad actor agents. This is the first wave of significant changes we've seen from President Trump's second term. The adjustments in this marketplace proposed rule aim to improve government efficiency, reduce spending, and reduce the number of fraudulent enrollments. As mentioned, we'll be keeping an eye out for updates. So if you're not following along already, press that follow button. If you have any questions about the proposed rules or selling ACA, our knowledgeable under 65 team is here to help. You can find their contact info in the episode notes, along with more resources. Thanks for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Emily Ryan, script proofing by Sarah Ruppel, recording and production by me, Tina Lamoureux. Podcast designed by Urban Rivera. Follow along with our show wherever you like to listen.